Hey guys, what's going on? Welcome to another video on my channel, Hairlicious. If you guys are new to this channel, please make sure to hit that subscribe button so that you guys are updated on hair loss topics, as well as my second hair transplant journey update. If you guys have not seen my previous video, the clinic that I actually went to get my hair transplant in South Korea, Motion Clinic, is offering a 51% discount for anybody who is able to travel to Korea before mid-April. I know that the majority of my viewers are from the US, and if you guys are a US citizen or green card holder, you guys are actually still able to go in and out of Korea with the ongoing COVID-19 situation. I wouldn't recommend it, obviously, because it's a risk to travel right now, but due to the tanking economy, all over the world, a lot of businesses are trying to give out enticing offers, and this is probably one that you guys will never see happening because a 51% discount is a pretty big chunk. And it's even better if you guys are already in Korea and looking to get a hair transplant. Now would be the best time to get it in terms of cost. Like I said, I'm not recommending anybody, but I just want to throw it out there so that you guys are aware, and for those who are interested. You guys are old enough to make your own decisions, but I'll leave the contact information in the description box for those who want to check it out in getting a complimentary consultation with Motion Clinic. Also, make sure to check out my website at HAIRLICIOUSLY.com for all of your microneedling needs to stimulate hair growth, my DH debulking shampoo and serum, low-level laser therapy treatment, hair supplements, and a few other products that can help for those suffering from hair loss. So today I kind of wanted to give you guys an update on one of the hair loss treatments that I've been following very closely over the past few years. This is one that can truly revolutionize the hair loss industry and replace current mainstream hair loss treatments like finasteride and Minoxidil that have been around for the past few decades. By now, most of you guys should know or at least heard of Breezula, which is a topical hair loss treatment in the works by the Italian pharmaceutical company Cassiopea. It used to be called CB-03-01 for their developmental code name, but they changed the name to Breezula, and their main compound in this topical anti-androgen is clascoterone. So Breezula works at the cutaneous level on the scalp by blocking DHT interaction with specific hair follicle androgen receptors. It's known to reduce prostaglandin D2, which is a hormone that can inhibit hair growth, especially if it's elevated in high levels. And the wonderful thing about Breezula, and the reason why so many people are interested in this topical, is because it does not interfere with the hormonal and androgenic profile of patients. This means that libido, sexual dysfunction, brain fog, and other conditions that are known to cause side effects due to hormonal changes were not found in the clinical studies up to date. And we also know that a lot of you guys who are suffering from hair loss are hesitant to taking finasteride because of the associated side effects, and something like Breezula can stop that while helping you maintain and even regrow hair afflicted by androgenic alopecia. Now, the last update that we got from Breezula was on their phase 2 completion of their dosage ranging trial that took place in Germany last July. Results were extremely positive after 12-month phase 2 clinical trials. In a nutshell, people between normal 3 to 5 applied various dosages of Breezula, and it was confirmed that the best dosage for maximum hair growth was at 7.5% solution applied twice a day. So basically, 7.5% dosage twice a day was comparable to the 12-month target area hair count shown for oral finasteride at just 6 months of 7.5% solution of Breezula twice a day. So literally, it actually reached the same efficacy of finasteride 1 milligram in just 6 months and without the side effects, which I think is just insane and it's just amazing. And at 12 months, there was 14.3 new hairs per centimeter squared, as well as target area hair width increase, which is all positive and exciting news. Now, Cassiopea was actually planning on proceeding with a 6-month phase 3 clinical trial towards the end of last year after consulting with FDA, but that has obviously been delayed due to the whole coronavirus pandemic. And as you guys know, Italy has been hit pretty hard with COVID, and the last time that I checked, I think there's been about 50,000 confirmed cases of corona patients and nearly 5,000 people that have died. And the scary thing is that the number of infected people is just growing exponentially in Italy, and I think one of the reasons behind this is that Italy has the second oldest population in the world, and this means that younger people need to tend with the elderly, their grandparents, and which also means more exposure to the virus. And even with a full lockdown in place in Italy, it definitely is going to obviously delay Breezula from starting phase 3 clinical trials. And until we have a better understanding and control of COVID, I can't really speculate when Breezula is going to be available. And there's a good possibility that even phase 3 clinical trials are not even going to begin until early next year. The good news is that Cassiopea already has other products that use a compound clascoterone in different dosages. For example, the treatment of acne, which has already gone through phase 3 and NDA acceptance by the FDA for August 2020. And there is also clascoterone female pattern hair loss, which phase 2 trials that are supposed to be completed sometime mid to late 2020. So I'm not too worried about them getting or at least for the topical version for hair loss being approved. But the newsletter did also state that once approved, Breezula is expected to be priced around $100 to $200 per month, which I think it's a little bit expensive, but considering that it is effective at regrowing hair and maintaining and without the possible sexual side effects, I don't think that it's going to be too far-fetched in my opinion. Now, it has been pretty bad at my workplace as well. Working in a law enforcement environment, my job is open 24/7, and there has actually been some confirmed cases of coronaviruses even at my work. And as we speak, I actually came in contact with somebody with COVID. So I actually had to go to the hospital yesterday to get tested. If you guys are looking to get tested, some hospitals do offer testing, but it's going to be limited since they don't have the full resources to test anybody. I was lucky enough to get tested since my wife is pregnant, but if you don't show any symptoms, I don't think they are going to test you. There's also facilities in each state that you guys can go to once you have a doctor's prescription. They pretty much did a mouth and nasal swab and sent them to the lab to get tested, and I'll probably find out in the next 6 days or so. Now, I didn't show any symptoms, and it's already been about 10 to 11 days since COVID, or since my last contact with COVID, but since it can be asymptomatic, I still wanted to get tested so that I don't risk my family or those around me. And it's nerve-wracking because it's not like you can shut down a facility that operates 24/7, especially when you have to vet international passengers entering the US from high-risk countries. So as CDC recommends, the best thing you guys can do is to practice social distancing, washing your hands for at least 20 seconds, wearing a mask, and limiting social interaction with other people. And until this thing actually settles down, the economy is going to continue to collapse. Many businesses are going to have to file for bankruptcy, and many companies that are currently researching for better hair loss treatments are going to get delayed. This applies to any other current mainstream hair loss companies that are researching. Everything is on standby, and until we, as a nation, are able to either find the vaccination or quarantine this completely, it's going to be difficult to get further updates as far as clinical trials. Anyway, that's all I have for you guys today. If you guys have any questions, make sure to leave me some comments below. You guys can reach me via email at hairliciously.com. You guys can check out the contact page on my website. But thanks for watching, guys. Stay safe. Make sure to, keep your social distancing with other people. And I will talk to you guys in my next video. Take care.